Today I will discuss the relation between pregnancy and cancer. And everybody knows that cancer is the most frequent disease in women and is the second cause of death after lung cancer. And one of the mechanisms that we would like to do is to prevent the disease. And there have been several conventional thinking for the prevention of breast cancer. One of them is diet, to modify the lifestyle, and also hormone control. For example, to treat women with ovariectomy or even inhibitor of estrogen like tamoxifen and roloxifene, as well as aromatase inhibitor. We thought that maybe we need to think in a different way. And one of the first questions that we ask ourselves is, why certain women do not develop breast cancer? We know that it's one woman out of 8 that will develop breast cancer, but what happens with the other 7 that they don't develop breast cancer? And the answer has been in certain way given in 1700 by Bernardino Ramazzini. He was a very interesting person because he was the first epidemiologist that we know, and he found that women that live in convents, nuns, have more breast cancer than the women that have in the general population that we are bearing children. And he made the first relationship between pregnancy and breast cancer. And he said that women that have an early pregnancy are protected against breast cancer, where women that never have children, they are more susceptible to develop breast cancer. And this was confirmed almost 300 years later by Matt Mahon in a very important publication. And later on, our group tried to understand why pregnancy produces protection. Now, the reason why pregnancy produces protection is the objective of this talk. And you see the mammary gland at birth is formed by very rudimentary structure, like this one, that is called terminal duct. This structure, like the tree in winter. When women start the adolescent period, the menstruation period, the terminal duct start dividing, forming alveolar buds. And then in the full development of the mammary gland in the pubertal girl, form this kind of structure that we call lobulus type 1. And then with successive menstrual cycle, the lobulus type 1 develops in lobulus type 2, and if pregnancy supervenes, this structure develops lobulus type 3. Meaning that you can see here that the breast tissue is like a tree in winter here, in which there are very few branches, and a fully developed branching like in spring or summer. And that is very important because the reason why there is a significant difference between the breast tissue of women that have children versus the one that they don't have. For example, nulliparous women, they develop from lobulus type 1 to lobulus type 2, such as you see over here, and they enter in involution and go back to lobulus type 1 in menopause. Instead, the women that have an early pregnancy, the mammary gland develop completely, go from lobulus 1, 2, 3, and 4, and later on involute. And at menopause, you find that both breasts, the nulliparous and the parous women, have lobulus type 1. But the difference is that the lobulus type 1 have been going through the process of differentiation, meaning that have been going through the whole process of maturation produced by pregnancy and lactation. And we postulated that the reason why this takes place is to modify the mammary gland in a way that made them more refractory to carcinogenesis. Now, how we demonstrate that? We went to a population in Sweden, specifically in Luleå, and we collected breast tissue from women that were nulliparous and parous women. And we made this study, this core biopsy, were analyzed in Fox Chase in Philadelphia, and we analyzed all the genes that were expressed at menopause. And what we found? We found that all the nulliparous women are here in red, and the parous women are here in green, meaning that the parous women are here and the nulliparous are here. Meaning that all these red points here, each of these columns is a woman, and each of these in horizontal bar is a gene. Meaning that the genes that are found in the parous women are significantly higher than the gene that you find in the nulliparous women. Meaning that there are significant differences. And what are these differences? The differences are that those genes activate proteins that are the ones that control the differentiation of the breast tissue. And more importantly, they control certain specific mechanisms that called splicing mechanisms, chromatin remodeling, and long-coding RNA. I will try to be very clear about this because I know that this is not the kind of thing that you are used to hear. For example, if you have a gene in the DNA, when the gene wants to be transformed in protein, it's called transcription. And you see here that every gene is formed by two components in the DNA, the exon, another exon, and there is some portion of the DNA that is an intron, it's a bridge. But in order that this gene that is in the DNA can produce a protein, you need to eliminate these introns. This is clear, meaning that you eliminate the introns and then all the exons get together and form a protein. For example, you have the albumin protein. In order to form the albumin protein, you need to eliminate from the DNA all the introns. Now, the thing that we found is that this complex of eliminating these introns are very complex, are more than 36 genes that are located in the nucleus of the cell that are producing this effect. And we found that the reason why nulliparous women develop more breast cancer is because they have an alteration in the way that they eliminate the introns. For example, nulliparous women have more introns retention, meaning that for one reason we don't understand, the breast tissue of nulliparous women retain these introns and produce an abnormal protein. Meaning that this kind of retention that is observed in the nulliparous women are not produced in the parous women. And this difference is so small but so important because the cell detects when these kind of introns are present there. If these introns are there, the protein that the cell produces is abnormal. Therefore, in the parous women, they have the mechanism to eliminate all the introns and the protein is normal. It's like to have two systems of security in your home. One in the door, another one near to the bed. Near to the bed is the one that says, wait a minute, it's a burglary coming here. And that system in the parous women is working much better than in the nulliparous women. Because when they detect that there is an intron there, in the parous tissue, they remove that intron and the protein is normal. I hope that you can follow me that concept. Now, but there is another complexity add to this one. If you want to knight we want to use a yard and then to produce some specific kind of tissue, you need to take the yard and then put apart. And the cells do exactly the same things. When the cells are really in a state of resting, all the DNA is very dense, like this one. It's condensed, like this one. And when you want that the DNA express the protein, they start separating itself. And that is something that we call heterochromatin and euchromatin. The parous women have the ability to take the DNA and form some kind of a big ball in order that they are not open, meaning that it's more condensed. That is called a heterochromatin. Instead, in the nulliparous women, the DNA is more loose and they can transcribe any kind of genes, meaning that in certain way, the parous women have the ability to produce a more condensed DNA that don't allow that these genes are expressed easily. Now, in addition, we found that this process is a very complex. I will not enter in detail, but it's due to the methylation, meaning the addition of a methyl group in the DNA that allow them to produce more condensation. In addition to this complexity, there are a small fragment of RNA that is called long non-coding RNA that are more frequently found in the parous women that are not found in the nulliparous women. And we found that there are 21 of these non-coding regions that are present in the parous women that are not present in the nulliparous one. And these long non-coding regions that are very important because they are controlling the way that the DNA is measured. In summary, I know that this is not the piece of cake that you eat every day, but this is an important concept. The concept is that all these mechanisms that going on at the level of the cellular level, are the ones that make the parity more protected against breast cancer. In other words, make that the DNA is more protected against developing of the disease. And the important part is that whatever happens during early pregnancy that takes place between 24 and 30 years of age produces significant modification in the breast tissue that make them more refractory to carcinogenesis. It means that whatever happened there in this specific window in the lifespan of a woman is protected for life. And this is very important. Even if you don't recall all the other elements, the important is that whatever happened in the breast tissue during this period made the mammary gland protected forever. Now, the problem is all the time more complex than that, because you will say, but there are certain women that have an early pregnancy, but they still develop breast cancer. And the matter of fact, that is correct. There are certain women that after pregnancy, they develop more breast cancer. Now, what is the mechanism of that? Therefore, the question was, what happened with the premenopausal women? And we went back to Sweden in order to collect breast tissue from women that were between 25 to 45 years of age. And we took the core biopsy of them, and what we found? We found that if we analyze the cell of the breast tissue every 5 years, at the time of pregnancy, 5 years, 10 years, 15 years, we found that the genes were different. And you see here that one peak is in blood here that only is present during the first 5-7 years after pregnancy. Other genes in green are constantly high, and other ones that really are very high at menopause. Now, this is very important because this had never been reported before. Now, what are these genes that are here really in the first 5-6 years after pregnancy? Because those genes maybe can explain why certain women that have an early pregnancy still develop breast cancer. And we found that the genes that are controlling this one are related to the immune system. In the way that they are related to the immune system is that suppose that a woman get a damage in the epithelium of the breast tissue. Then the immune system recognize that and give the message to something that these dendritic cells. Dendritic cells, are very in all the part of the body, and they are detecting there is an antigen there. They cut the antigen that belong to a cell that has been neoplastically transformed or getting cancerous and produce killer cells. And those killer cells, what they do? They go and to destroy the cells that have been initiated. Meaning that this is a very important concept. There are a mechanisms, immune system that is activated during the first 5-7 years after pregnancy that allow to detect when a cell is going to cancer or not. Now, the problem is that not all the pregnant women develop this immune system. There are certain women you'll see over here that they don't stimulate these genes. We don't know why, but the reality is that there are certain women that after pregnancy, the immune system is different. Therefore, they don't activate those killer cells that will destroy the malignant cells. And those are the women that we expect that will develop breast cancer. And we have indication that this is the case. But we need to wait a couple of years in order to see that we are in the right idea, in the right direction. But all the experiments indicate that when this immune system is not activated after pregnancy, after the 5-7 years after the first pregnancy, those are the women that are more susceptible to develop breast cancer. Meaning that explains why certain women that even have an early pregnancy, they still develop breast cancer. And then we have other genes, like the green one, that they are activated at the beginning, and other ones that are activated at the end. And the one in the green are related to differentiation and chromatin remodeling and so on. But seems to be that the immune system, the ones that are activated in the first 5 to 6 years, are extremely important in order to produce protection against breast cancer. Now, this is nice. I mean that we know now why this process of pregnancy protection takes place. But what we can do about it? We cannot make that all the women get pregnant. That would be very impractical. And therefore, the thing that we have done is to first study in a model how we can induce protection against cancer without pregnancy. And the way that we did it is the following. Let me explain a little bit. In the rat, if you give them a chemical carcinogen, they develop 100% of them develop breast cancer, mammary cancer. And this is a very fast model because you inject today and 50 days later, all of them have cancer. Therefore, this is the model that we use in the lab in order to understand how we can protect the mechanism. Therefore, we found that the tumors start in this structure, like similar to the lobulus type 1 in the breast, and they develop intraductal proliferation and carcinoma in situ like human. Now, and we found that there is a relation between this structure and the development of cancer. But if you differentiate the mammary gland in the rat, like this one, for example, you produce lobulus 2 or 3 by hormones, then you make this animal refractory to carcinogenesis. Therefore, we thought, what if we give to the animal, instead of pregnant, we give hormones like contraceptive agent, or ACG, human chorionic gonadotrophin, that is produced during pregnancy. And we did that. And we found that whatever hormone we use, we protect the animal. But the one that protects the most is when we give to the animal human chorionic gonadotrophin. If we give to the animal for 21 days human chorionic gonadotrophin, the animal is protected for life against development of breast cancer. And that was a very important finding, because now we can protect breast cancer given a hormone. And we found that the same mechanism that we found in human is induced by the ACG, meaning that you give human chorionic gonadotrophin and you see all the molecular mechanisms that I mentioned to you, splicing, chromatin remodeling. You see exactly the same phenomena in the animal, meaning that ACG can replace pregnancy without pregnancy in order to protect the breast tissue against breast cancer. Now, how we test this concept? Okay, we now have a way. Where we go now? And then you need to try to use in human. And the thing that we have done is to use women that have BRCA1, BRCA2, meaning the women that have hereditary breast cancer, because this is the only one that really are interested first to, if the woman that has BRCA1, BRCA2, the only option that they have is mastectomy and ovariectomy before 40 years of age. Therefore, we started a clinical trial in the University of Gwen in Belgium, and we are using women that have BRCA1, BRCA2, but don't have breast cancer, and we are treating them with ACG for 3 months. And we found that these women, also when we test the breast tissue of these women with ACG, they produce the same kind of genomic activation that we found in the part of women, meaning that the trial is not complete yet, but that indicates to us that we can really produce protection against breast cancer inducing the genomic signature of pregnancy without pregnancy using this hormone. Now, we are working on that. We don't know yet how. In order to test, we need to have 23 women. We are only 5 women that have been used the whole treatment. But what is the next step that we want to do? The next step is that in order that these women can be protected, they need to receive every single day 5,000 international units of ACG intramuscularly. And some of them don't like too much that. Therefore, the next step that we are working is what happens if we chop the hormone in pieces. And then we found that when this is the receptor of the hormones, and this is the whole hormone. It's a very complicated hormone that has 180 amino acids. And then we are chopping in fraction of 15 amino acids. And the thing that we are finding that one of the 15 amino acids bind the receptor and produce the same effect that we use for the whole hormone. Therefore, the idea that we have, and this is an experimentation, is to take this fragment, put in a dermal patch, and then give it to the human in order to see that this dermal patch that can be done for 3-4 months will produce the same effect. We don't know yet the effect, but this is in the drawing board of what we want to do. In summary, the thing that we want to do is to have a personalized intervention in breast cancer prevention. First, instead of making a biopsy of the breast, that we can find the same gene activated in the serum, that we can get the blood from the woman and they say, okay, the genes are activated, therefore this woman will be prevented by pregnancy or not. The second thing that we want to do is to to treat women with this small fragment of HCG in a patch in order that they can produce the same effect of the whole hormone without pregnancy in order to be protective. And the next thing that we need to do, that will be the most difficult one, is to try this in larger population of women in order to see that we are right or not. Okay, in summary, what is the home message that I want to tell you? The message is that breast cancer prevention is based upon the mechanism of differentiation, meaning that the reason why pregnancy produces prevention is because the mammary gland differentiate. You take a mammary gland that looks like a winter tree and make a summer tree from there. And during this process, all the genes are activated in a way that make the mammary gland refractory to carcinogenesis. A very easy concept. Those molecular mechanisms are produced because the thing that you are doing at the end is vaccinating the cells against cancer. Why? Because you modify the structure of the cell in a way that the cell can protect by themselves. And the beauty of that is when you do that, the cell is protected. It's like a vaccination. You don't need to intervene anymore because you have modified the structure of the cell in the way that the cell manages the problem. And human chorionic gonadotrophin mimics pregnancy without pregnancy, and that is a very important concept. And we are planning now to continue working on that in order to produce small molecules of this HCG in order that we can administer easily to the women and see that we can use this in a strategic way for prevent breast cancer. I hope that this is clear for you, and at least it's some kind of light of hope that we can prevent breast cancer. Thank you very much. I don't know if you want some questions. Yes?
Where did you say you're doing the final testing of women? The most recent one.
We are doing in Belgium, and the reason is because in Belgium. Yeah, and the reason is because the European breast cancer prevention provides the money to do that. In order to give an idea, to treat every woman from this one requires $25,000. Why? Because we need to be sure that this woman first don't have any problem in the ovaries. We need to do a scanning of the ovary. We need to be sure that this woman is normal. We need to do the test in order to be sure that they are BRCA1 positive and so on. We need to pay the nurse, the doctor, and so on. I mean that it's very expensive. And this organization they wanted to do something about that, and they are putting the money in front, and we are doing over there. If we are successful with this clinical trial, then of course we need to get more money to do this in the larger population of women.
Because I can't imagine that this would be possible in the United States.
Extremely difficult. We tried to do here, and it took 5 years to collect 3 women.
Oh my gosh.
That.
I can't believe you got approval to do it.
Yeah, they approve it because they are BRCA1 positive, meaning they are women that have a risk of breast cancer. BRCA1 women, meaning the women that have mutation of this gene have 80% chance to develop breast cancer. Meaning that the approval was no problem. The problem is I will say that the women really want to go through this process. And you need to have a dedicated gynecologist they went to, and we have that in Belgium that they wanted to do that, and hopefully we can do it.
I'm wondering for the future, are you planning on extending this to prevention of breast cancer for all women, with a vaccination perhaps, because it's not just women who have the gene mutation who get breast cancer?
Yeah, that is the objective. Meaning that the objective is that if we demonstrate that this is working for women with this mutation, then the next step is to really use that in the whole population, in younger women. Yeah, that is the objective. I hope that I don't die before we can accomplish that, but this is the objective.
Thank you.
Yeah. Yes?
My question is, why the age of pregnancy is a risk of a breast cancer?
That is a very interesting question. There is a critical period between, mutations are the ones that originate at the end cancer. And the more happen between the mammary gland differentiated and pregnancy, the period, the window is larger, and then the woman accumulate more mutations. Meaning that the woman develop for 18 years of age, or 20 years have less mutation than the women that have 30 years of age. And mutations that are coming from many different aspects: environmental carcinogen, smoking, alcohol, whatever. I mean that we can talk about the whole day about all the possibilities. But the point is that the younger is the breast, the more susceptible the breast is to get mutated, to get cancer. The best example is what happened in Hiroshima and Nagasaki. When the bombing time took place, the women that developed more breast cancer were not the older women. We are the girls that were between 10 and 14 years of age, because the mammary gland was so undifferentiated that they were easily mutated. And those glands are the ones that later on develop breast cancer. Meaning that the earlier we produce the differentiation of the gland through pregnancy or through hormones, the more easy to eliminate those cells, those stem cells that are in the mammary gland that later on develop breast cancer. Did I answer your question? That is the reason why early pregnancy is so important. But the problem is that we as society are changing. A girl at 18, 24 years of age is still studying, is still didn't form their family yet. Therefore, something needs to be done in order that we can really differentiate the gland without pregnancy. Before, in other times, a girl starts menstruating and she gets married. But that is not the case anymore. That is the reason why we need to differentiate the mammary gland in order to vaccinate the breast tissue against, in a way that the breast can take care of itself. That is the objective. Okay?
You said
One more.
5,000 IUs of HCG per day.
5,000 every 2 days.
For how long?
For 3 months.
3 months.
That is the protocol that we hope works.
And because that was so intense,
Yes.
you want to take the pieces of HCG.
Exactly.
Okay, thank you.
Exactly. Yes?
You may have mentioned this, but I'm a little bit confused at all this. You said that there's still, a majority of, there still are some women that have had children that are still very susceptible to getting breast cancers because they still have the mutant gene
Immune response.
Immune response. Now,
Yeah.
do you have a test for those women? I mean, are you testing those women?
This is a very thank you for the question. This is very pertinent because the concept is if you have an immune system that really detects when the cell gets cancer immediately, the organ, and this is the basis of the actual immunotherapy, to produce cells that kill the cancer cells. That is the basic concept. If the organism has the adequate activation of the dendritic cell that recognize when the cell gets cancer, immediately develop killer cells that go and kill the cell. Now, for reasons that we don't know, certain women, even that have pregnant, they don't develop that. And the thing that we are doing, try to develop, we are not yet, but we want to test if the genes that are involved in this process are activated in women. And we want to know if we can detect that without doing the breast biopsy, that we can detect in blood. And we are developing that, but we don't have the answer yet. But that is the objective, that we can say, okay, this woman, we made a blood profile and we have that genes are activated or not. But we need to see if the same gene that we found in the breast are found in the blood. Meaning that this is a tricky question, but this is the real question to answer.
Right, because you could compare the ones that have it and the ones that don't.
Exactly, yeah.
And maybe try to take the ones that do and give the ones
And
that
and we have the blood of these women, meaning that we can do that. The problem is, first, to develop the taste, and second, to get the money in order to produce all the fact. But yes, that is the real question to ask right now. Yeah. Okay. I don't want to take time for the next speaker. Thank you very much. You have been a terrific audience. Okay.